are live. This is the Marketplace Reset. I'm Anthony Weeks, and we're joined by my colleagues, Carolyn and Lynda in the Washington, D.C., Maryland, Virginia market. Ladies, good afternoon. How are you doing today?
Good afternoon.
Good afternoon, Anthony. We are wonderful. We are wonderful.
Fantastic. How's the weather there? I've been hearing folks talk about the
Thumbs
change in temperature.
Oh my goodness.
How is it? How is it in the DC area?
It's a beautiful early fall. It's nice and crisp. It's not hot. We have had a lot of rain, but we are focusing on prayers for our colleagues in the southern states as this weather event and the Caribbean.
Yes.
But right now we're doing very well here in the DMV.
Absolutely.
Fantastic, fantastic. So I'm looking forward to today's discussion. Tell us what to expect. Share with our audience who we have on today and what we'll be talking about.
Well, we're really very, very proud and privileged to have a Dr. Lie. And I saw his name and thought it was Lee as well. It's Dr. Lie. He is very, very accomplished and has some information that's really going to be beneficial for us. He'll talk about what his specialty is, and then he's going to draw things in for us so that we can look at COVID in a bit of a different lens.
Fantastic. All right, let's bring up the good doctor. And I see him in queue. I'm sure he's excited to be part of the conversation. Good afternoon, doctor. How are you?
Good afternoon. I'm doing fantastic. Thank you for having me here.
You're welcome. Welcome to the Marketplace Reset. So my colleagues, they do a wonderful job, coordinating and inviting guests to the program. And so I'm really excited about today's discussion. So ladies, do your thing, and I will chime in from time to time while you have a good conversation with a good doctor.
Wonderful.
Fantastic. Well, how are you doing, Dr. Lie?
Hi, Lynda. Great to see you again.
Good to see you. And we see you. And this is Carolyn.
I didn't
Hi,
have
Carolyn.
to meet you earlier. Well, I read all about you, and I read a lot about your history. So we're excited to have you here and to listen to some of your insights.
Yeah, so why don't we just hop into it, because Carolyn and I have a tendency to, and our guests, to eat up the entire time. And there's a lot going on. So we're going to do our little tradition to let you know what's happening on our end. So because we know you're going to have, we have our orange books.
Okay.
Our pens, so we take great notes. So Dr. Lie, I know that you are seeing a lot of patients here in Washington, D.C. metropolitan area. But first, let's get a little bit of introduction as to who you are. And we love for our guests to kind of self-introduce, because you have an amazing background. Can you give us kind of some highlights of your career?
Sure. Very much thank you. I am a physician specialized in spinal cord injury medicine as a subspecialty, also physical medicine and rehabilitation, which is a practice that we treat folks who have neurologic injuries, both catastrophic and acquired neurologic injuries such as MS, spinal cord injury, brain injury, stroke. So I encounter a lot of these people in the nursing home situation, in the rehabilitative situation after the acute event occurs.
Yeah.
I have spoken all over the world, I guess. The furthest I've been is Beijing, China, training physicians in how to manage disorders and symptoms related to these neurologic disorders.
Outstanding. I mean, that's a huge specialty. One of the things that we talk about on our segment is kind of the whole restart of our economy, but also the health of the individuals in our economy. And are you seeing any correlations between your these, maybe an uptick in these events, stroke in particular as an example, and COVID-19? Are we drawing any correlations between an increase of cases or not, perhaps?
Well, I think there has been mention that COVID-19 can cause an antibody storm, or an event where the body attacks itself. Part of that is causing thromboembolic events. So the body hypercoagulates, or the blood thickens dramatically and very quickly. This has led to an uptick in strokes, especially in young people, strokes in the elderly, as well as embolic events where people are losing limbs, fingers, and legs. So yes, I have seen quite a bit of the effects of this disorder or this virus on the general population that we otherwise wouldn't have seen.
Especially young people. Would you, young people like in their 20s and 30s or even younger?
I don't see pediatric patients, so I couldn't speak to that, but definitely there have been reports, and I've seen people having strokes in their 30s and 40s that otherwise were relatively healthy and didn't have issues related to conditions that you would consider more commonly associated with stroke and those disease that progress at a much older population, in a much older population.
So am I understanding that perhaps persons that are exposed to COVID, then because of this antibody storm, are more predisposed to having a stroke at well, it's always a surprise, I would say, but they're more predisposed to having a stroke?
Sure. The body, in response to an organism, that being the virus, which it's never seen before, can sometimes get confused, and in an effort to protect itself, it shoots out antibodies, just something that might be similar. It might have been a flu that you had 10 years ago or some other infection. So in that storm, you can produce antibodies that hypercoagulate the blood, and that causes those events. That
is fascinating. We've not heard it quite like that.
No.
That makes a great roadmap to what we need to be watching out for. Dr. Leah, can you give us, to your knowledge, any ways that we can prevent that as it relates to, okay, we know masks and we know social distancing, but is there something else that we should be mindful of as we think about what you just told us, which is phenomenal, which is really, really important?
Well, I think the best approach to any fighting any virus is to not catch it.
Yeah.
So we start by wearing masks, and we start by wearing masks properly. I see people kind of pushing it down below their nose and up, exposing the mouth.
Yeah.
So you want to wear your mask properly. You also want to make sure that if you are feeling ill or even mild symptoms, you want to stay away from vulnerable populations, the elderly, the obese, anyone who might have pre-existing conditions, severe hypertension, diabetes, pulmonary problems are a big issue. So sometimes we have to take care of each other.
Yes.
Wash your hands when you enter your home so that you don't expose your family to anything that you've encountered outside. Some people take off their shoes before they go into the room. My colleagues as physicians, some of us took off our clothes completely in a shed before we entered our homes.
Wow.
And washed, bathed, took a shower immediately.
Wow.
So it's those kind of efforts that you should institute in order to prevent spread to other people if you do happen to encounter the virus.
Well, that's so one thing I
you.
think early on, and thank you for that information, Lynda, and thank you for helping with that. One thing that we noticed early on is that we were very, very vigilant in doing so many things, but like with anything else, as time wears on, and we haven't seen people dropping in the streets, if you will, even though deaths are continuing to climb and every single death is impactful. But we've become less and less vigilant, and some of the messaging around how to take care of ourselves has been so relaxed. So you're saying that even now, right now, September the 16th, these are kinds of things that we really need to be continuing to practice.
Sure. And let's just go back to clinical medicine. You would be shocked if a surgeon walked into your surgery suite to operate on you without a mask on.
Yes.
Would you not?
Wow.
You would be equally as shocked if a dentist came to work on you and didn't put a mask on. So we've never really stopped practicing these habits. It's just that now a wider group of people are needing to adopt them. So hand washing is very common. We tell children to wash their hands, especially during flu season when they go to and from rooms. This is not new information. It's not surprising. We've been doing it for quite some time. We've been relaxed doing these activities for quite some time. So it's just important that if you manage the basics, hand washing, if you feel sick, cover your mouth with a mask. If you go out in public or you're not around people that you've been isolated with for a significant amount of time, wear a mask, etc. Common sense.
It's common sense, and we hope that people will practice and take our listeners and viewers will take your advice because it's critical. So let's talk about a couple of other things. I know that you have done some phenomenal work with NIH in your history and research and looking at back then other types of epidemics and pandemics. And can you take us a little bit of a journey through, kind of just touch on what you did before? Because I think it's a great conversation to say, what did you learn then that we are applying now in response, or somehow we're not learning the lesson and we're having to re-engage newer, different methodologies around dealing with pandemics and epidemics like this? Sure.
I'd say that some of the more experienced physicians, I won't use the term old, but older physicians remember the AIDS epidemic and the prevention measures that we instituted for preventing the spread of HIV at the time. During that time, I was working at National Institutes of Health, working on identifying the HIV reverse transcriptase genome. And if you recall, Washington, D.C. was definitely a hot spot for the spread of HIV. So we commonly, and in the hospital systems, we were still washing our hands, being very careful, wearing masks, even back then. But we became more stringent in our blood transfusions and making sure that the pool of blood was not contaminated. We started double gloving at the time when we went into surgeries and we performed surgery. Double gloving was very common at that time. It may still be now. I'm not operating as much as I used to or doing as many procedures. But these were techniques that we were doing back then. This is what we have to do now is institute, or what we are doing now is instituting those same efforts with a little bit of modification based on the type of transmission that the disease it can be passed through.
Yeah, that's interesting. So would you give it a grade A, B, or C that we have learned our lessons? And if not, I don't know what we're going to do. We don't need another pandemic to go to the head of the class. How would you grade it? Because you're close on the front line. What would you say?
Sure. Well, I have gotten a chance to get out in public, and I will say in the area where I live, I see quite a bit, or very few incidences where people are not wearing masks, where they're not social distancing. And I do want to add that social distancing doesn't mean not being friendly to people. You can still say hi through a mask, and your smile can be seen in your eyes. So that doesn't mean that you have to kind of, run across the room and isolate yourself and others. But I think people are doing a good job. Now, in some areas of the country, we've seen that folks really don't want to adopt these efforts, and unfortunately they're starting to pay for that kind of behavior.
Yeah, we're seeing that and we're hearing that and we're just distressed over it almost. But one of the things that I have come to appreciate about your practice, Lead Medical Therapy, that we want you to make sure that you give your web address and a way for folks to contact you in the DMV particularly, or those who are across the country that might need your services. So let's make sure we get that in. Sure. But tell us a little bit about Lead Medical Therapy. I know that you are ahead of the game in terms of virtual and remote, and tell us a little bit about how your business is doing, the business of what you're doing as part of surviving or pivoting, or thriving, because there are some people who have not missed a beat in the pandemic economy, as we're calling it.
Sure. My practice is in rehabilitation medicine. That means most of my patients have disorders such as spinal cord injury, stroke, multiple sclerosis, and other neurologic injuries, Parkinson's, etc. That population is usually disabled and has a difficult time with transport. Okay. Nowadays, with two families or two people working in the home, when someone is elderly or has an injury, it's difficult to get those patients back and forth to doctor's visits. Okay. And one of the things I wanted to concentrate on when I left National Rehabilitation Hospital and came to start my own practice was I wanted to make sure we really catered not only to the patients, but to the caregivers.
Wow.
So we wanted to create an environment where caregivers felt healthy so that they can be healthy for the people that they need to care for.
Very important.
Wow.
So our first step was to become as digital and virtual as possible. Mm-hmm. And that includes being able to send documents back and forth to phones or computers for signature under HIPAA compliance, of course. Mm-hmm. Performing telemedicine activities when possible. If I suspected a visit would only last about 15, 20 minutes, I didn't want somebody to travel an hour or to take Metro Access van to come to my office for that particular reason. Procedures were very different. That was worth the time spent to travel. But I wanted to make it easy on the caregivers. So one of the things that we do, we have a post-stroke rehabilitation clinic where anybody that has a stroke anywhere in Washington, D.C., they can come to this clinic and really learn about their disorder. At that clinic, we evaluate the caregivers, and we have a questionnaire which determines caregiver load, because we want to make sure that they're nice and strong and healthy, that they're enjoying their lives while they're giving care to their family member that may be disabled.
Caregiver load. You're giving me chills just thinking about that, because that is normally the unsung soldier, and it's the person most likely not to be taking care of themselves because their priority is their parent or spouse or child. So that's, or their employer in this case.
So that sounds very state-of-the-art thought process. That's a great thought leadership to actually incorporate into your practice a methodology that says, and a process that says, we're going to look at the caregivers, and not only that, we're going to evaluate them.
Yes.
Because your work can only be supported by a caregiver, because they're your eyes and ears and your support in the community or in that family. Are you finding that other physicians are thinking through how to do this better, just like you have already instituted? Because now we're all virtual.
Right.
Mm-hmm. Well, I'll tell you that a lot of my colleagues are overwhelmed by this process or the processes that they have to undertake as a result of the pandemic. The telemedicine, the answering emails, answering texts, it's somewhat overwhelming because unfortunately, medicine has been very slow to adopt the digital world. I do have colleagues that are still writing in charts, handwritten notes, handwritten prescriptions, etc. So that group, unfortunately, is a little bit behind the curve, and they can be somewhat overwhelmed. I started this process 4 years ago.
Oh,
wow.
So
you were really ahead of the curve. That's so forward.
Mm-hmm. My members of my team are digital. I manage 4 clinics in the Maryland area from a digital perspective. We have we've been having video conferences and meetings for over a year and a half now. So we were very, very prepared for this. I can do now virtual evaluations. I treat patients who have chronic migraine headache using Botox. which is a very effective treatment. That population doesn't need to come to me for an initial evaluation. That can be a telemedicine call. And we're also working on some applications where we can have that person do their initial evaluation on their phone to see if they qualify for treatment.
This is amazing. One of the things that we've been seeing all over the news that speaks to this is a lot of people have been postponing care. Either their doctor's offices, as you mentioned, may not have been up to speed to accommodate them in a virtual setting, or maybe their own personal fear. And as a result, things that were otherwise manageable, because they've waited, there's been loss of life. So you make it easy from the onset to use the technology that we always have around us, because most people have a cell phone that is within an arm's length of them at all times. You've made that so helpful. Would you say for those persons who really do need to come in, is your office outfitted so that there is such a peace of mind if they have to show up in person?
My patient population, that phone that you showed us just a second ago, in many cases, that's their window to the world.
I love it.
They can be isolated and only have a caregiver come in, a paid caregiver from an agency, possibly twice a day, sometimes once a day. So we started out early on reaching out to those people. I'll give you an example. When the pandemic hit, we did shut down for about a week. But instead of having to set up telemedicine, which we already had, instead of having to set up communications or electronic health record systems, which we already had, we were able to, I think I got a blast text messaging service and a blast email service. We were able to pull down everyone's information from our electronic health record system where we held that, and we sent out a quick message to them, letting them know what guidelines they needed to follow if they needed to come in. We also directed the patients that did not need to come in to the fact that we were going to do our follow-up visits virtually so that they wouldn't be exposed. The other nice thing that I didn't think about was that many of my employees are virtual. So I have one person in the office with me who greets people at the front desk. She and I were the only points of contact. So that's a great way to reduce people's exposure to a virus or any other kind of organism, because you just have less folks in the room.
Yeah. You know, that's so brilliant, because it reminds me of what are going to be our lessons learned coming out of this for business. And, you know, we focus on the health, but also the health of business, the health of professionals such as yourself. It seems to me that colleagues are going to now need to really incorporate that digital footprint. There's no other way to effectively go into the future at this point. And not just because you want to have an immediate response, but because it brings about a measure of economic efficiency and service quality, I would think accelerates when you bring in and incorporate the type of technology and strategies that you have deployed at the lead medical therapies. I'm sorry, Leah. Medical therapy. So we commend you for that. So hopefully your colleagues are looking at you and taking notes. My goodness. Well, tell us a little bit, make sure we get your email, not your email, but your website, so everyone can in fact contact you, because after today,
sure,
the fact that you understand the caregiver, that alone is just remarkable. So how would any individuals be able to reach you in the DMV for services such as yours?
My email or my staff email is info at Lea Medical, that is LEA, and the word medical.com.
Okay, great.
You can send any correspondence to that, and Deborah will contact you.
Wow.
Also, I did want to mention, you did mention my colleagues out there in the field that are struggling with these problems. I have offered consultation services, in particular to private practitioners who are looking for a way to digitize their offices very quickly. And make their staff very efficient. I've been getting calls and speaking to people about these efforts. I would say that over the last 4 years, I've made those mistakes that they don't need to make that they don't need to make.
Yeah.
And I've found those programs and systems that are working well in my office. The one thing that I've noticed is that my staff is very happy, and I get a lot of good feedback from them about not only the freedom, but the efficiency of communication, as well as getting great feedback from my patients.
Yeah.
I love that.
You know, that's what you feel like the country doctor that comes to your door and just knocks on it and says, I'm just checking on you,
Right.
you know, because it's that level of touch and care that creates a very health-centric environment in the home, in the nursing home, in the workplace, among your own staff, which has to be one of the first things that you think about in terms of care and yourselves. And so we commend you on that. It sounds like you've done some great work, both in the research space, in the community space, and now really reaching out to your colleagues is beyond commendable, because if we can get everybody on the same page with that level of consideration, efficiency, care, and I think it's called bedside manner. Is that correct? Am I saying then you know,
bedside manner now.
Bedside manner.
That's it.
That's half the battle. You know, that really is to quality healthcare, and we commend you for that as well. So we're just gonna make sure everyone gives you a call and emails the leamedical.com. So LEA medical.com.
And we also have the ability to receive a text to my office phone number, which is 301 495 3742.
Well, I'm going to be one of the first persons that text. I have a few issues I'd like to chat with you about offline.
Sure.
But I do want to thank you for reminding us. Sometimes we think that it is the most technologically advanced thing that's going to change things for us. But you mentioned that we should manage the basics, that we should be wearing a mask. We want to make sure that we wash our hands regularly, but particularly after coming outside. We want to keep in mind that our footwear could be part of the problem.
Yes.
Leave your shoes at the door. And if we're not feeling well, and see in the past, if you weren't feeling well, but you trudged through and went to work, went to school, or went to the store, people thought, what a trooper, you're amazing. But you're helping us realize if we don't feel well, stay home, but get it checked out. So these kinds of reminders are absolutely what we need to know right now, so that moving forward, we can be healthier.
And I think also, Dr. Lier, it's really critical for us to not forget the work that you've done both in the research space, because what we learn now hopefully will help the clinicians and the physicians and the practitioners and the paraprofessionals of the future, if not the broader society. Because if hopefully we will come out of this digitally strong, economically efficient, and really building a community around points of excellence. And what you've just described in your practice is a point of excellence. So we see Anthony.
I know, right?
When Anthony plugs in, that means he's got questions and he wants to fly you down to the Caribbean.
I know, right?
All over the place, Anthony. So just in case you had a question, we'll let you come back in and ask Dr. Lier. What do you think? You have a question?
Just real quickly, because I see we have our other guests from Health Point Plus in queue right now. But the NIH is that the National Institute of Health? Did I get that right? Okay.
National Institute.
You were involved in research, extensive research with the NIH. And at that point, you know, HIV was a huge problem. How would you, on the scale, say the panic between COVID-19 and AIDS? Because people, we were panicking during the HIV/AIDS epidemic. And so, how would you compare the two at this point?
I would say that the concerns are pretty strong, as from what I remember back then. Remember when HIV when HIV first came out, we didn't know if it was passed through saliva, touching. People were afraid to go into rooms with each other. If someone was sick, individuals were completely isolated. I think we're seeing some of that now, which is why I mentioned earlier that one of the things that we need to do to get through this is really take care of each other. We need to communicate. Now that we do have digital means, FaceTime somebody. I don't want to use just one, but you can communicate visually with people if you feel uncomfortable. Check on your friends and family. We've seen a increase in mental disorders, and I will tell you, in the hospital system, we have exposed many mental disorders through isolation that have never been noticed in individuals before. And I'm speaking to my colleagues that are psychiatrists, and they're seeing the effects of isolation on their populations. So we need to check on each other, and we need to make sure that the disabled are watched and communicated with. We don't want to isolate each other now, not even on the streets. Say hi to people. No one, people have a mask on. They don't have a knife or a gun in their hand. You understand? So it is important that we, at this time, try and unpanic a little bit, communicate with each other, and I think that will reduce some of this contact anxiety.
I can appreciate that. I think we are ready for coming out of the panic and moving into a level of being proactive in a different way. And you've given us some amazing roadmaps to be able to do that, Dr. Leah.
So we really want to thank you. You make it so easy for us, but I tell you, we're completely impressed by what your practice has done. You did mention that there were 4 clinics that you manage in the region. Are you able to tell us just very quickly where they may be located?
We're located, sure. I'm affiliated with a set of physical therapy gyms called TheraFit. They are located in the Baltimore region. You can find them online.
Wonderful.
I work with them intimately, primarily because that's where the patients go.
Yeah.
And again, in an effort to reduce caregiver load, we want to be where the patients go on a regular basis. So if they go to the physical therapist and they're going through their therapy, we want to be there when they're treated so we can watch them. If we're going to institute a management such as spasticity management or supplying them with a brace or a piece of equipment, we can watch it in action. And that saves the caregiver one more visit.
Wow.
That they don't have to show up for.
Wonderful. Well, we thank you so very much. We see our colleagues trying to pop in, and as usual, we've taken a little bit of their time, so I hope they don't mind. But guess what we did? We took a lot of notes. So if you saw us looking down, we have our notes. And we thank you very much. We thank you, and I'm sure your patients are thanking you. So continue to do great work out there in the community, in the DMV. And we'll share you, Anthony, we'll share Dr. Leah with the folks across the country and down in the Caribbean Basin.
Absolutely. Thank you, Dr. Leah. Thank you, Dr. Leah. Did I say that right? I said Leah at first, but it's Leah.
And we're actually doing some work in the Caribbean now. We have a relationship with the Bahamas. So bring me back. We'll talk about that.
Wonderful.
We'll invite you back on to have more dialogue just about what's happening in the Caribbean.
Absolutely. Thank you so much. Coming up next is our guest from Health Point Plus. And when we come back on the other side, where this is a quick promo on Health Point Plus, it's a really nice video in terms of their technology and what they provide. Coming up next is Conte from the VP from Health Point Plus. We'll be right back.
Okay.
Good news. Your employer got you a great new benefit. Telehealth by Health Point Plus. No more waiting for office hours and pleading for an appointment, or paying exorbitant fees to go to the ER or a walk-in clinic. You now have access to doctors anytime, anywhere, right from the convenience of the phone in your pocket or any PC. When it's particularly great, middle of the night, avoiding bad weather, avoiding traffic, parking headaches, and driving debacles. When you're traveling, our board-certified physicians regularly treat over 70% of traditional initial visit symptoms. The visits have no visit fee, and they're unlimited for the whole family. It's easy. Just log into your employee portal, launch the app and register, answer some health and symptom questions for a doctor to review, initiate a session, get a diagnosis, and maybe a necessary prescription to a nearby pharmacy. Done. Welcome to the family of HealthPoint Plus. Enjoy, and here's to your health.
All right, folks, well, we're back, and I'm so excited to have one of our strategic partners when we put together the JumpStart economy, reopening, and chain of efficacy in terms of how do we respond in a responsible, safe manner for both public and private sector. We looked at who were out in the marketplace providing their solution, and we were fortunate to have come across a partner that we believe are very proactive, very innovative in terms of how they're approaching, being able to not only deal with how do you effectively respond to the whole COVID-19 pandemic, but going forward, what happens to technology after the pandemic? And so we're going to have a conversation with Conti from HealthPoint Plus. Conti, good afternoon, my friend. How are you?
Good afternoon. That was a great video. Where'd you get it?
You like? I'm glad that you're approved, my friend. How are you doing?
So thanks for having me on the show. Great show. I was listening to the previous segment also. Pretty interesting. Yes.
Our colleagues from around the country, as you know, Conti, JumpStart economy reopening and chain of efficacy is a national campaign.
Absolutely.
And so we are expanding our network of correspondents and contributors and strategic partners that bring their unique solution to how we can effectively mitigate and navigate and really provide a roadmap to the best of our ability to deal with, to respond to the pandemic. And your company is doing some great work on that. Why don't you share with the our viewing audience a little bit about yourself and your organization? And today's topic, by the way, which is for me, I'm looking forward to this topic of discussion because we tend to use this interchangeably. When we say telehealth, telemedicine, it means the same thing, which it does, but it doesn't. And so we're going to get into the weeds, if you will. Take a deep dive as to the difference between telehealth and telemedicine. And Conti's going to do a great job. You wrote a great article. I'm gonna ask Conti if we can publish that article on our news and information segment of JumpStart.
Sure.
It's a good article, and I would like to be able to do that. So, Conti, why don't you tell our audience a little bit about you and your organization and the work you're doing, and then we'll get into what's the difference between telehealth and telemedicine, and how is telehealth helping small businesses, local businesses, and their employees?
Yeah. So I'm an electrical engineer by education, but it has nothing to do with medicine. But I've been involved in the medical field for the last 6 years. My passion is to somehow address our broken healthcare system by reducing the cost for employers and employees. So this is my second company in the medical field. I knew the people before I joined them, and I love working with them because we have some great ideas that we're working on. So HealthPoint Plus is, in one sentence, we provide subscription-based medicine. Now, again, we're going to talk about terminology. So under subscription-based medicine, there are a lot of different products that we add, like telehealth, telemedicine, teletherapy, virtual primary care. We also have diagnostic home kits. So all they come under the umbrella of what I would call telehealth, and we'll talk about that. So that's what our company does, and we are excited with the partnership that we have with JumpStart Economy.
Fantastic. So when we talk about the different service providers in the market, and we talk about telehealth and telemedicine, for the layman person, how would you put in perspective for them what's the difference between the two?
So before I start with that discussion, can I say something? Did you know that you cannot catch a virus, even coronavirus, over the phone? Not yet anyway.
No, are you serious? And I did not know that.
Because that leads to the word
Wait a
tele.
minute. Stop the press a sec. Stop the press. You cannot catch the virus through a phone? Oh, my goodness.
So not only telehealth is convenient, but it's also safe. And especially in the current pandemic situation.
Mm-hmm.
So telehealth and telemedicine, I'm the first one to admit that I'm guilty of using them interchangeably. But word tele means obviously at a distance. So we're already familiar with terms like telegram, television, telecommunication, and to that we can add telehealth or telemedicine. So a lot of people use the word telehealth because they think telemedicine is limited, because telemedicine might mean ordering a medicine at a distance, like a online pharmacy. But to me, telehealth is an umbrella term. So everything that has to do with any connection with a healthcare activity or telecommunications is telehealth. And under that category, we can have subcategories like telemedicine. And when I speak of telemedicine, I mean where a patient gets diagnosed and then gets prescription and gets treated. That is telemedicine. There are other things that you can do under the umbrella of telehealth, like remote monitoring, remote patient monitoring. You can do wellness programs. You can do teletherapy. So all of these things fall under the umbrella of telehealth. And then we can think of telemedicine as something there where a patient gets diagnosed and treated.
Mm-hmm. Good. I'm glad. My colleague, Teri Coaxum, perfect timing. She came in
Hi, Teri.
when I wanted to segue into before the pandemic, right? No one really knew what telehealth was, right? And under the umbrella of telehealth, you have all of these different subsections, titles, as to what the universe of telehealth is. And right. and so, when whether a small business, local business, mom and pop, major organization, and their employees, and the use of telemedicine, not only in the pandemic, but going forward, what is telehealth or telemedicine going to mean for the average American, average person, average small business? Teri Coaxum is our expert on small business. She spent a considerable amount of years with the SBA. She was the advocate, small business advocate for the SBA in the New York metropolitan area, Puerto Rico, the Virgin Islands. So she knows small business, and I'm sure she's heard it all in terms of the challenges and the hardship that they're dealing with. I can't imagine what it's like in this environment. But what would you share with us in terms of your subscription service? Number one, okay, the difference between subscription and I guess just a one-off telehealth service. Describe what the subscription is and how does that benefit a business, small business, and their employees.
Okay. So before I start, let me make a sort of a sweeping statement. Technically, telehealth or telemedicine can benefit all businesses and all individuals. But having said that, we're in the middle of a pandemic right now where small businesses are hurting. They're hurting for cash. So telemedicine can help those who are underinsured or uninsured. Don't forget the 20 million plus Americans who are currently, lost their jobs and they need some help as well. So when we talk about small businesses, I put these small businesses in two categories. Those who offer health insurance to their employees and those who don't. So let's talk about the ones who don't offer health insurance. And we know why they don't, because health insurance is too damn expensive, and many small businesses just can't afford it. So for them, being able to offer telemedicine as a subscription is a great way to give a peace of mind to their employees. So now they know they have some place to go to. And the benefit to the small business who does not offer health insurance to their employees, they can offer telemedicine at a fraction of the insurance cost. And I'm talking about like less than 1% of the health insurance cost. So it doesn't cost that much for them to offer this, and that helps them with their recruitment and retention. So that's the big benefit. And then, of course, employees are happier because they have peace of mind. They know where to turn to when they have a medical issue.
And how do you think, obviously the long-standing debate on healthcare in the United States, private insurance, government-sponsored insurance, universal healthcare, the different models, policies on the issue of health and medicine in this country. How do you think, or what do you think the landscape is going to look like now that telehealth and telemedicine has really been thrust in the middle of this issue? Do you see futuristically that it's going to impact the cost of healthcare and the cost of insurance in this debate?
Oh, absolutely. And I'm going to give you the example of the businesses. So we already talked about some small businesses who don't offer insurance. They can provide this at a very low cost. If they had insurance through, those uninsured people who had insurance through some public means, typically they end up with very high deductibles. So that insurance is still really not useful to average person because deductibles are typically $5,000 or more even. So having a telehealth as part of that insurance allows them to take care of the routine medical issues without adding any extra cost for any visit. So that's where telehealth comes in and reduces the cost of overall medical costs. Now let's talk about small businesses who already offer health insurance. And by the way, even if they offer health insurance, the cost is always a consideration because it's still very expensive. So what they typically end up doing is purchasing health insurance for their employees with very high deductibles. And $5,000 deductible is not uncommon. So when you have a $5,000 deductible, by providing telemedicine at a very low subscription cost, in addition to that health insurance, which is really under insurance, employees can at least take care of the out-of-pocket expenses for routine medical visits. Because once you have this subscription, they don't have to pay any co-insurance, no co-pays, no deductible, no out-of-pocket insurance. So high deductible insurance combined with a very low cost telehealth subscription is a great benefit to their employees. And from the employer's point of view, they have happier employees, therefore it helps them with their recruiting and retention.
My colleague Teri is there, and she is the lead correspondent for this segment. Teri, I'm sure you have some disposition on the issue. You're in a pretty huge market, the New York tri-state area. What are you hearing? What kind of feedback? What impact is telemedicine is having in the New York tri-state area, particularly with small business, local mom and pop business?
So one of the things that's happening, especially locally with small businesses, getting certain individuals to go to the doctor is very hard, especially males, right? So yes. It's like
especially younger millennials.
Exactly. So with our mom and pops, for those that can afford, because like you said, health insurance is extremely expensive, and even those of us that are, our own business owners, it's even hard for us. I know when I left SBA and I started paying for my own insurance, the COBRA insurance alone was extremely expensive. It was like I was paying my rent. That's how much I was paying in my insurance. And so one of the things that mom and pops are really concerned about as it relates to healthcare, they would like to make sure that their employees have healthcare, but it's expensive. And so we're always looking for other options. As far as telehealth and telemedicine, it makes it more convenient. Like I said, most, I'm not going to say males again, but a lot of folks, a lot of young people don't believe that they need to go to the doctor, and a lot of people feel like they don't need to go to the doctor, and it's more convenient to have to call in or go into an app. I see, like, my daughter uses the app for her son who's 10 years old, and I'm really surprised by that, but she'd rather do that than to go in to sit into a doctor's office. And so telehealth and telemedicine, I think, are really going to be extremely important in the future. I think that people are trusting more. They haven't trusted in the beginning, having their information on the computer, but of course, with all the HIPAA laws in place, making sure that information is secure. For me personally, I remember when my doctor asked me to give him my email address for my chart, my health, and I was able to go into that app and see everything that I've done over the year. That to me was so convenient. And when I had another follow-up appointment with another specialist, I was able to say, here's what I did. And they were able to look at that information and write it down as well. And so that information is vital. There was a point where it felt like it was like pulling tooth when you wanted to ask your doctor exactly, what was going on with your body. And now you have all of that on an app. And I think that we're going to have a lot more of that. It's less expensive than having a system in place where everything is in a file cabinet. You can switch doctors in between. I think that's going to be important, especially for young people. Young people like convenience. They like to be able to move around, and telehealth and telemedicine allow them to do so.
So are you saying that I hear a theme? Young people are going to be really interested.
I really do believe so. Absolutely.
And so you think this is going to be an invaluable tool for recruitment of young people to different companies, right?
Absolutely.
Because it's technology based. And, basically small businesses are going to become more competitive in their ability to attract good talent, top talent by the use of offering telehealth in terms of their benefits with the employer?
I think that having those benefits are definitely going to attract and recruit more individuals because of the technology. I do believe so. There are other things to take into consideration, like what's going on now with COVID, the flexibility. I think that's also going to be huge for recruitment purposes. For a small business and talent, right? Being able to work from your device, being able to check your doctor's appointments, being able to, have your money deposited directly into your account and see where your money's moving and going. All of those things I think are going to be invaluable in recruitment of young people, technology based individuals to your company. I think that's going to be absolutely, yeah, I do think so.
Hey, Conti, we have a
question to Teri, Anthony.
Sure, go ahead.
So Teri, in your experience, if you think of small businesses under 50 in the category of mom and pop shop businesses, what percent of these businesses, in your experience, actually offer health insurance and don't?
Not a lot of the mom and pops.
There you go.
Not a lot of the mom and pops are able to offer health insurance. Like I said, it's very expensive. Even for me as a small business owner, it's very hard to try to get insurance, especially comprehensive insurance for individuals. It's very expensive. Like I said, when I left SBA, I was forced to pay COBRA, and I was paying over $800, $900 a month in health insurance. For that first year, I paid $15,000 plus just in health insurance for myself. And this wasn't even including the family. This is just for myself. So that's a very hard hit for small businesses, especially mom and pops, to have that cost added to all the other things that they have to do, especially during this pandemic, because they're kind of tightening up their belts. And so that's really, in my experience, that's been the case.
So for small businesses, how much do you think, Teri, costs our subscription for telehealth?
I think a subscription would be half that.
It's only $10 a month for the whole family.
See, and that's the difference, Anthony. See, that cost effectiveness, I think, is also going to be a recruiting tool. You know, $10 for the family compared to $700 for one person, and that's not even including co-pays, deductibles, and medicine.
It covers routine care. You know, you still have to pay for your prescription, but then we offer some discount drug plans. You have to get a lab test. But most of the time, you don't need to do anything. You have a call with the doctor and it's taken care of. You know, 70% of the issues are already handled by a video chat or a phone call.
For $10 a month.
$10 a month, family included. Now, we know, and I heard on the previous segment, that mental health has become a big issue. I think mental health, depression, and anxiety are skyrocketing right now because of the pandemic. So we also offer teletherapy, which is an appointment with a therapist, certified therapist, for $10 a month.
And that appointment,
but that is per adult per month.
Okay, that's what I'm asking you, per adult per month. And so that's one appointment per month?
No, you can have multiple appointments. Some may need more, some may need less.
Interesting. Okay, yeah. Because I'm seeing a lot, especially here in the New York region. We have something called New York State of Health, and we have something called Thrive. Our first lady, Mayor Bill de Blasio's wife, started the mental health awareness, and so there's training and things around it, and so you can call that 1-800 number and talk to a therapist, and it's been really, it's been really in use because of, especially now, the pandemic, right? So there are other companies that have offered that same service, but it's expensive. I can tell you without fair contradiction. I know I saw a couple ads for that type of service where and it wasn't subscription based, but it was mental health therapy, and it was $180 a session.
So
and that was on the low end side. They said this is the COVID price.
Unfortunately, folks, we've come to the end of this segment. We're out of time. Conti, we're going to have you back. We have so much. We got something to talk to you about. And coming up, our guest is Commissioner Joseph Bosholti from the U.S. Virgin Islands Department of Tourism. We just heard from the Vice President of HealthPoint Plus, Conti. Conti is one of our HealthPoint Plus is one of our strategic partners, and we look forward to future conversation. He'll be back on the program. Teri, see you on the other side on the second segment.
JumpStart the economy.
All right. Thank you so much, guys.
Thank you, Conti.
Thank you, Teri.